I am the advanced practice nurse here at Baylor Irving who sees patients and families with terminal and life-limiting illnesses. A large portion of what I do is talk to them about goals of care, advanced care planning, and then I help folks make that transition over to hospice as needed. The chaplains work really closely with myself and also with the social workers. They help us do advanced directives with our patients. And the way I approach those conversations with them is we sit down and talk about what medical interventions would you or would you not want. So would you want to be on a ventilator? Would you want us to chemically or electrically restart your heart if your heart stopped beating on its own? And we have to talk about with families that have young children, are there godparents? Would you need a guardian? Do we need to talk about state center of trust? And sometimes that kind of falls outside of what I do because I'm not a lawyer, but we have social workers that can make community referrals, which is really great. The nice thing about advanced directives is it's a patient's voice when they cannot communicate for themselves. It can be something that people can change as their situation changes, as their health conditions change. I have advanced directives completed. I've had them completed since I was 20. And one of the reasons I've had them for so long is because my father was military, and anytime deployment occurred, you had to update your will, medical power of attorney, living power. So that was a discussion we have had as a family since I was a small child. I've had patients and families who've told me that if we had not had this advanced directive, I would have never been able to stop, and I would have never been able to sleep at night because I would have been continuously second guessing myself. So it's not a hard thing to do. I think it's just a scary thing for folks to do, to sit down and think about their own mortality. I think one of the great things that Baylor Healthcare System has done is recognize the importance of completing an advanced directive, and they've made it really simple for patients and families to have access to this forms. What they can do is go to baylorhealth.com/mydecisions, and they can download the different types of advanced directives, complete them, review them with their family members, but then also take that important next step and take it to their primary care physician or any specialist they may see to review it with them, so their healthcare provider also knows what medical interventions they may or may not want in the future.